Thank you for holding out. My name is David Meinertz. I'm the founder and CEO of Zava. Most importantly, I'm a patient. About 10 years ago, I was diagnosed with high blood pressure. My doctors told me it's very safely manageable. You just need to take the repeat prescription medication every day at the same time of the day, and you need to control this medication once a year to go and see your doctor face to face. And in between this one checkup per year, I needed to go to the doctor to pick up my repeat prescription. And 10 years ago, it worked like this. I needed to call the surgery. I needed to wait to get through to the secretary. The secretary told me, yes, I could probably come back in a week or 2 weeks to actually get an appointment. I then needed to drive to the surgery, sit in the waiting room with really sick people for about an hour, and then I didn't even see the doctor. I got handed a piece of paper, which is called a prescription, which is already pre-signed by the doctor, and I didn't even get to speak to him. Zero value. And then I needed to carry the prescription into the next pharmacy, and typically the medication was not in stock, so I had to return the next day. This is a really, really poor experience for patients, and that leads to kind of lack of adherence and really the drop-off in interaction between doctors and patients. And this is why I founded Zava. Our mission is to build accessible, dependable healthcare, which is at a fraction of today's cost. So we started in 2011, and we've since grown to be the largest digital healthcare provider in Europe. We currently provide over 100,000 digital consultations, which are self-paid to patients in Europe. And in 2018, we provided more than 1 million consultations so far. Over the last 8 years, we've provided around 3 million consultations across 6 markets in Europe. The largest markets for us are the UK and Germany, followed by France, Austria, Switzerland, and Ireland. Now, how have we actually won in these 2 markets, in these 6 markets? We've won there for 2 main reasons. Number one, we've delivered an exceptionally convenient patient experience. And number 2, we've really focused on maximizing the healthcare model for doctor efficiency. So how does Zava work? Let's take a very popular service of ours, let's say the contraceptive pill. Lots of young women find us to get contraception via Zava, and so a patient would find us online, complete a condition-specific questionnaire in which we would ask all the relevant questions the doctor would typically also ask face-to-face. The patient, however, can complete it on the bus, in front of the TV, at work, whenever she sees fit. There's no need for the waiting room, there's no need for an appointment, there's no need for a call, nothing. Once this questionnaire is complete, our doctors will, typically within the hour, review the questions and then assess whether we can prescribe the repeat prescription or whether we need to refer the patient to a face-to-face consultation. Most of our patients can actually be dealt with online, and the doctor would then provide advice via an online patient record and send the prescription to a nearby pharmacy for the patient, or send it to a pharmacy which would then deliver the medicine by post. Patients love this experience because it's ultra convenient. No need for an appointment, no need for a call, no need for a visit. And regulators, which is equally important, really appreciate this level of interaction between patients and doctors because it's structured and leaves an audit trail because all the communication is in written format. Now, the principle is very, very simple. The more information we're able to collect from patients, the more we can structure the data, and the more we can already pre-qualify the data and route it to the relevant doctor. So today, we pick up information from medical questionnaires for most conditions. For skin conditions, we ask patients to upload photos, and for other conditions, we send out a lab test. So we can get actually the information from the lab about whether there's an infection or something else missing. And over time, we have integrated wearable devices to give us blood pressure measurements and weight measurements and so forth. The idea remains the same. The more information we can collect from patients in real time and give to our doctors, the more we can increase the efficiency of our doctors on our platform. And today, A doctor on the Zava platform for the conditions we currently treat is around 20 times more efficient than a regular face-to-face GP. And you will see here that over the last 5 years, we have continuously increased the number of consultations we provide. However, the doctors in our system have become increasingly efficient to a matter that they can now provide around 1,000 consultations because of our software. So contrary to what other people have said before, so we're not trying to replace doctors on our platform with artificial intelligence. And we're not just putting doctors on video to have a one-to-one setting and a consultation. We're building software which enables our doctors to treat patients very safely and very efficiently. And this software also enables patients to have a super convenient journey. Now, why is that actually important? It's important because we are all getting iller, we're all getting older, and as a society, we don't want to spend more money with healthcare. And this is where efficiency has to come in. So how will Zava capitalize on this opportunity? We'll capitalize on 3 different levels. Number 1, about 70% of all conditions can actually be treated remotely without a face-to-face interaction. So you don't actually need to go and see your GP face-to-face to get diagnosed and treated for most conditions. It can actually be done via questionnaires, via interactive chats, via communication in writing, but also with all the measurements we can already provide to the doctor today. We're currently treating around 5% of all conditions, and our plan is to expand this range of conditions over the next 2 years very significantly. Number 2, it's the awareness. Most people don't actually understand and know that they can get treatment online. However, our research shows that when people understand they can get treated online, 2/3 of them actually convert and become our patients. The third opportunity is what we call free at the point of care. So currently, every single patient who comes to Zava and gets treated pays out of pocket between 9 and 29 euros, depending on the type of consultation they ask for. And we know from our funnel that most patients, when they realize they need to pay themselves, they actually drop out the funnel. What we've seen in the UK, in Germany, and in France is that statutory healthcare providers, such as the NHS or big insurance companies in Germany and France, want to enable their customers to benefit from this experience for 2 reasons. Number 1, because they want to own the customer journey, and number 2, they want to reduce costs. So the assumption is that when we deliver this treatments free at the point of care for the patient, the conversion and the attractiveness of our offer is greatly increased. In the first year when we started, the total addressable market was very, very small. So although I felt that I had a problem to access my GP, most other people didn't. However, over time, over the last 5 years, consumer expectations have increasingly shown that banking they can do online, travel they can book online, food delivery they can do online, and really healthcare is the one vertical which was very much behind. So over the last 2 years, we've seen an ongoing growth in total addressable market for what we call self-pay or private healthcare. However, this is totally dwarfed, but what we call free-to-patient healthcare, which means statutory healthcare providers, employers, and insurance company will pay for the patients at the point of care. We're currently treating patients out of London in 6 different markets: Germany, UK, France, Austria, Switzerland, and Ireland. And we are expanding into Spain and Poland over the next 2 years. And Europe is the beginning, but we see that our model is very, very attractive in other markets worldwide, particularly in the US. Over the last 8 years, we've built a team of around 190 doctors, developers, marketers, and researchers in UX who continue to build this world-class service. In summary, we have raised at the very beginning only £1.2 million, and that took us to a turnover run rate of around 55 million. and we've identified very significant opportunities to grow much, much further. And today, I'm very delighted to share with you that we've raised a round of $32 million. We closed it a few weeks ago to do three things: extend our leadership position in what we call private healthcare in our existing market and new markets. And number two, take an emergent share of the statutory healthcare market, which is rapidly developing in the UK, in Germany, and in France in particular. And number three, launch into new markets in Europe, in particular in Spain and in Poland over the next 2 years. Now, 32 million is quite some money, particularly if you haven't raised a lot of money before. But the opportunity is so big that we're constantly looking to increase that amount. So if anyone's interested or wants to understand more about Zava, I'm very pleased to talk to you outside. Thank you.